morning, ladies and gentlemen. My name is Yusuf Ali Mohammed. I am a student optician here at Georgian College. Ocular health and ethnic diversity. Ocular health on its own is a topic, and ethnic diversity on its own is also a different topic. But I'll try and put them together. As far as ocular health is concerned, it is the health status of the tissue and structures outside and on the surface of the eye. Simple as that. I mean, when you're talking about the health of the heart, the health of the liver, it's just as simple as it is health of the eye. Ocular diseases, I'll be talking to you about cataracts, age-related macular degeneration, glaucoma, and a few refractive errors. And it's actually nearsightedness and farsightedness, myopia and hyperopia. Now, how many of you in this class have heard about any of these diseases? It's a good number. I'll be talking to you about certain structures of the eye. I don't know, because you guys are a biology class, I don't know how much you know about the eye. A few diseases I'll be talking about. So before I go into any of those diseases, this is the basic structure of the eye. And what you'll see here is we'll start with the cornea. And the cornea is pretty much a transparent refractive media of the eye. So all its job is to refract light onto the retina, which is the red part back here. Now, the retina is a light-sensitive tissue, and that is where images are formed. You won't be able to see the cornea here, so I got you another picture down here. It's just a transparent refractive media. The lens is it's called the crystalline lens. It's inside the eye. Its job also is just as a refractive media of the eye. The pupil is the black dot in the middle of the eye. Its job is to regulate the amount of light entering the eye. The iris right there is the colored part of the eye, and its job is to regulate the amount of light again. I won't be talking too much about anything else on there except the macula, which is, I'll talk to you about that after. Don't want to really break it to you. So, I'll start with cataracts, and it's the leading cause of vision loss globally. A lot of people in the world that are affected by cataracts. It's a very simple disease, and most people get it, but it can lead to blindness. It occurs by the clouding of the crystalline lens. And I talked to you about the crystalline lens. It's a refractive media inside the eye. If the crystalline lens clouds, you will not be able to see. Images will not form on the retina. Now, the crystalline lens is composed of protein and water. The only thing, what happens is when you age, the protein begins to disintegrate and the crystalline lens starts to cloud. If not treated, it could lead to blindness. Causes, there's eye surgery, excessive UV exposure. That is why sunglasses are important. One more thing about sunglasses, now that I'm on that topic, is don't go buying sunglasses just off the racks from people. Those are not polarized lenses. It's better to have polarized lenses. Polarized lenses will block out any amount of UV. Diabetes and smoking are other causes of the disease. Treatment is available. I told you it's a very simple disease. Once the crystalline lens clouds right here, as you can see, that's just the lens. That's how it would cloud. What surgeons do, ophthalmologists, they take that lens out and they replace it with an artificial lens. It's a simple procedure, but it's pretty scary, I guess. Age-related macular degeneration. Affects the macula, and that is why I didn't want to talk to you about the macula before. The macula is an oval-shaped, highly pigmented spot in the center of the retina. It is responsible for central high-resolution vision. What I'll have you do is make a fist and put it right between your eyebrows and just look straight ahead for me. You will see a difference in vision, and that is what happens to a patient with age-related macular degeneration. That spot gets affected, you do not see central vision. The age-related macular degeneration is caused by drusen, which are tiny extracellular materials that form. The presence of drusen is usually normal. People age, extracellular material ages, and drusen forms. However, if drusen increases, it blocks the macula. So you can see that is a picture of the retina, and that's the tiny yellow spots in the center of the retina right there. Age-related macular degeneration comes in two forms. There's the dry form and the wet form. The dry form is not that serious, but it could lead to the wet form, which I'm going to be talking about soon. Dry form, what happens is when the drusen start to accumulate on the macula decreases in size. Now I'll show you. I'll go back a bit, and I'll show you that picture again. That is the drusen. That's where the macula is located. So as you can see here, as drusen accumulate, that macula is decreasing in size, and when that happens, you're losing your central vision. The unfortunate thing about age-related macular degeneration is that there is no treatment available. Scientists are working on a form of treatment for dry macular degenerations. They haven't come up with anything yet. However, they say that vitamin supplements may improve vision, things like zinc, vitamin A, and I won't go into the biology of all of that. So, as far as wet AMD is concerned, what happens with it is when the macula decreases in size, the brain triggers the growth of new blood vessels to accommodate for all of that loss. Because these new blood vessels are really fragile, they're new, they're really small, they can leak blood and serum into the macula. So now you already have a decreased macula. On top of all of it, you have blood and serum leaking into it. It's a serious disease. A lot of people have it in Canada. I'll be talking to you about that later. Now, when blood and serum leak into the macula, photoreceptor cells are damaged. And what happens, again, is that the blood and serum also go over and around the eye. Treatment to remove all this blood and serum is available. What they do is they put a needle into the eye and they suck all the blood out. Yes, it is kind of nasty. So they'll suck all the blood out. But as soon as they do that, the eye disintegrates. So what they do is they put another gas bubble in there and everything is back to normal. But, of course, your vision won't be back to normal. Currently no treatment available for wet macular degeneration. The only treatment that they've come up, well, not treatment, the only preventive measure that they've come up with is an injection that slows down the progress of it. But it's not that advanced yet. The next disease is glaucoma. It occurs when the optic nerve is damaged. It's as simple as that. And I was talking to you about the fluid in the eye. That is right here. So, in age-related macular degeneration, I'll go back for a sec. All the blood leaks into this area. And this is where all the fluid is. So all this is taken out. With glaucoma, as soon as this pressure increases, it pushes the optic nerve to the back of the eye. And that is when the optic nerve gets damaged. The optic nerve is responsible for transmitting these signals of the images to the brain. It is said that the brain sees, the eye does not see. The eye is just for the light-sensitive tissue at the back. Once that image forms, the optic nerve does its job, sends the signals to the brain, everything is fine, and then you can see what you're seeing. Glaucoma, there's three kinds: there's open angle, angle closure, and congenital. Angle closure is open angle is the most common. It is caused by the slow increase of pressure inside the eye. So it builds up as people age. It builds up if people work in certain environments also. As far as angle closure is concerned, it's sudden blockage of fluid drains. Down here in your eyes are fluid drains where tears and fluid gets out of the eye. Now, if these drains are blocked, what happens is the quick increase of pressure inside the eye. It is very, very dangerous, and it's usually an emergency. Congenital glaucoma is hereditary and it's present at birth. It's as simple as that. If parents have it and for example, if a woman has it and she's pregnant, the risk of her child getting it is quite high. Treatment for glaucoma is what eye drops. What happens with the eye drops is it just quickly reduces the pressure inside the eye, but if the optic nerve is damaged, it cannot be reversed. Refractive errors. Very few of you in this class are wearing glasses. Most of the ones that are probably nearsightedness. That is the most common one. Images form. As I said, the retina is the light sensitive tissue. We want the images to form there. But, for example, myself, images form here. If I do not wear my glasses, the images will form here. When I put my glasses on, images form at the back there. Hyperopia is farsightedness. Images will focus back there. We don't want that to happen. We want them here. So we converge the rays of light and the image will form there.